So how can we change cardiac output and total peripheral resistance? Well, cardiac output can be changed in different ways. You can, for example, stimulate the heart with adrenaline or noradrenaline, and that will cause it to beat harder and faster. Conversely, you could stimulate the heart with the vagus nerves, with the parasympathetic nerves. They release acetylcholine, and that will slow down the heart rate. In fact, parasympathetic stimulation doesn't have much of an effect on the force of heart contraction, but it will slow it down. So you could use your autonomic nerves to affect cardiac output. And cardiac output is also heavily dependent on the blood that's coming back into the heart, on the venous return. But that's a region which we won't explore at the moment. Total peripheral resistance is extremely important as well. And remember, that's the resistance of the entire circulation from the aorta all the way through back to the heart on the other side. Now, where is most of that resistance located? It turns out that most of the resistance is located in the arterioles, for reasons which I'll explain a little bit later. The arterioles then dominate total peripheral resistance, and they're also controllable. Arterioles have smooth muscle within their walls, and that smooth muscle can respond to lots of different things which will affect how contracted it is. If you constrict lots of arterioles, if you cause their smooth muscle to contract, total peripheral resistance will rise, and that will cause mean arterial pressure to rise. Conversely, if you relax your arterioles and lots of them dilate, total peripheral resistance will drop and mean arterial pressure will drop as well. Of course, if you dilate all of your arterioles very rapidly and you don't attempt any kind of compensation, mean arterial pressure would drop to the point where you rapidly feel faint and you might collapse. And that's the kind of thing that can happen, for example, in anaphylactic shock. So arterioles can be readily controlled, and that will change total peripheral resistance, and you can use that to maintain your blood pressure under different circumstances. There are lots of different things that will feed into the arterioles. For example, you've got the sympathetic nervous system. It turns out that for most arterioles in the body, sympathetic nerve supply is much more important than parasympathetic nerve supply. And in fact, many arterioles don't have any parasympathetic supply at all. So I'll restrict my attention here to the sympathetic nerve fibers. They release noradrenaline, and they would cause arterioles around the body to constrict, which would have the effect of raising blood pressure. There are hormones which can affect the arterioles as well. Those hormones would include, for example, adrenaline. Adrenaline under normal circumstances, released when you're exercising, causes the arterioles in skeletal muscle to dilate. But at high levels, adrenaline can actually cause constriction of blood vessels, and it has these different effects because it can work on different adrenergic receptors. Other hormones can affect the arterioles as well. For example, antidiuretic hormone is also known as vasopressin, and that word vasopressin refers to its vasoconstricting effect. Angiotensin II will also affect the constriction of blood vessels. We have paracrines, which can affect arterial constriction. A paracrine you can think of as a local hormone. It's something which is diffusing just locally through the extracellular fluid to get to, in this case, the smooth muscle cells, and perhaps one of the obvious paracrines is nitric oxide, which causes blood vessels to dilate. That's pretty important. Histamine is another paracrine which can affect arterioles around the body. Then we have some arterioles which can just work on their own, if you like. We have what's called a myogenic response. And some arterioles, for example the arterioles in the kidney, if the blood flow through them appears to be too fast, they can detect that and they can constrict. And as a result, they can reduce the flow of blood back to what it needs to be. So that's an autoregulatory component of how the arterioles will work. And then, of course, there are other things, for example, drugs and toxins, which can affect arterioles as well. Now, one of the really important things to affect the diameter of arterioles is metabolites. And metabolites are substances which are produced by tissues as a byproduct of metabolism. Now, this becomes particularly important during exercise, Because in exercise, let's imagine that one of your muscles is very active. Well, that muscle would be producing various metabolites. They cause the blood vessels, the arterioles passing through the muscle, to dilate, and that's going to increase the blood flow to the muscle. So that's called metabolic vasodilatation, and we'll come back to that a little bit later. So lots of different things can affect arteriole diameter, and in turn that will affect total peripheral resistance. Total peripheral resistance will then affect mean arterial pressure. So you can see that the control of arterioles is very much linked with the control of arterial blood pressure in the body. And the body can use this fact to try to maintain blood pressure at the level that it needs to be.